everyone. Welcome to our online breastfeeding class. I'm Annette. I'll be your instructor. And this class is in a PowerPoint form. So we will go ahead and get started. Okay, so this is a picture of the, it's called the Williams Tower. And this is of Summa Health, and this is where maternity services are housed. Maybe some of you have taken the in-person tour, which are available and free. Labor and delivery and the perinatal unit and Akron Children's has a NICU. That is all on the second floor of this building. That's where you'll have your baby, labor and have your baby. And then after delivery, you will come up to the fourth floor, the postpartum unit, or we also call it the mother-baby unit. And if you're choosing to breastfeed or pump or want to give baby your milk, that is where you will meet up with a lactation consultant. That's where our office is, and that's where we would visit you. So the tours are really good. You should, there's virtual tours, you can go online, and you can also go for an in-person tour. Okay, we always want to advertise our other childbirth classes and events that we offer. We have a one-day marathon childbirth ed class that's in person. We also have an in-person 2-evening childbirth ed class. We have a baby care class that's like a 2-hour one-time class. And then we have a CPR friends and family class that includes CPR for infants. As well as children and adults. Know that it doesn't give you a certification in CPR, but it does go through the steps of that. We have a grandparents class. Currently, we have that in person and remotely online. And then we have a pumping and back to work class. That's always kind of an adjunct to the breastfeeding class. And that class was developed based on your feedback, because on this class here, we will we'll touch on pumping and back to work, but some, for a more in-depth look, we have a whole class dedicated to that. Of course, we have the tours that I just talked about. And for after delivery, we have free breastfeeding support groups twice a week that are run by the lactation consultants. Of course, all of this information is available on summahealth.org, and that's the best way to sign up for it. Okay, a little bit about me. As I said, my name's Annette, last name Carosi. I am a nurse and a lactation consultant. The IBCLC, that's my lactation credential. It stands for International Board Certified Lactation Consultant. I've been doing that for 9 years now. I've been a maternity nurse for actually 28 years as of this past summer. I need to change that. And as I said earlier, I'm currently at the Summa Akron campus, and I just do lactation support there part-time. So I did breastfeed my own child for what it's worth. I just have one son, but he is 32 now. And so that was before I was a nurse. And so I have walked the walk, and I know that it's not always the easiest thing. There can be struggles. And my email is acarosi@summahealth.org, and I want to encourage you to email me at any time with any questions that you have. I'll get back to you in a timely manner, and I really enjoy what I do, and I'm here to help you in any way I can. So feel free to use that. Okay, and I also want to have everybody hear me say a very heartfelt thank you for any interest that you have in breastfeeding, whether you know that, oh yeah, this is the path I want to take, I really want to go for this, or you're just on the fence and want to learn a little more before you decide. Know that breastfeeding is one of the best things that you can do, not only for your baby, but for yourself. It is the normal and natural way to feed your baby. We know that human milk is best for human babies. It is different than other mammalian milk in its composition. And we know that all the milks are very species specific. So bunny milk is the perfect first substance in nutrition and protection for bunny babies, but human milk is different than cow's milk, is different than goat's milk, and is tailor-made for human babies. And we know from studying generations of folks that have received, formula feeding versus human milk feeding, that it does make a difference in the short term and long term for their health. Also know that any amount of breastfeeding is beneficial. Of course, the longer and the more exclusively that you're able to do it, the greater the benefits. But every drop counts, and do what you can do, and do what you want to do. So I said a lot of wonderful things about, breast is best. And yes, if you can do it, that is the ideal food for baby. But remember, the number one rules are to feed the baby, protect the baby, and love the baby. This is what makes you a great parent, not breast milk. So know that most women are able to produce plenty of milk to feed their babies, but not every woman on the planet is able to produce sufficient amounts. And breast milk does not a mother make. So I urge you to please not get too tied up in breastfeeding as a sign of your value, as a mom. Feed your baby and keep your sanity. And if you're struggling, you still want to go for it, seek out help. But it is breastfeeding, it is not the be all end all of parenthood. Feed your baby, number one. Okay, little overview of our topics tonight. Talk about some of the anatomy and physiology of breastfeeding, how it works. Some of the mechanics on how we position and latch the baby. How do we know when we feed our babies when we're breastfeeding? Big question. How do we know the baby is getting enough milk when we can't actually see the ounces of the volume that is going into baby? There are some very telltale signs, and we will review those. Then we'll talk about breast care for the lactating woman, the partner's role in all of this, and we'll touch on breastfeeding and working. Okay, how breastfeeding works. Some really nice videos in this program. So we're going to go ahead and watch this video and then review those points.
As a mom, to be able to feed my baby, it's amazing. Just to know that she's getting everything she needs from me is pretty cool.
Your breast milk is so nutritious and protective that it can lead to better health for you and your baby. Babies who are breastfed have fewer ear infections and colds, less diarrhea and constipation, and are less likely to develop conditions like obesity and diabetes than formula-fed babies. They are also at a lower risk of sudden infant death syndrome. Breastfeeding is important for mothers too.
Are you really hungry?
The longer a woman breastfeeds, the more protection she has against developing heart disease and type 2 diabetes, as well as ovarian and breast cancer. Plus, breastfeeding moms usually lose their pregnancy weight faster. And don't forget the strong emotional bond that comes with the close contact you get from breastfeeding your baby.
There we go.
You'll learn that breastfeeding creates this amazing, special connection between you and your baby. Basically, you're a superhero while you're breastfeeding. Baby has a cold, breastfeeding makes it better. Baby has an owie, breastfeeding makes it better. Baby misses you or is lonely, breastfeeding. Baby's tired but can't quite settle, breastfeeding is the answer.
The American Academy of Pediatrics recommends that for about the first 6 months of your baby's life, you feed them only breast milk and nothing else. No formula, water, juice, or solid foods, including rice cereal. They also recommend that you continue to breastfeed for at least 12 months, even after your baby starts eating solids, and as long as you both would like after that. While any amount of breast milk is better than none, the longer you breastfeed, the more benefits for you and your baby. With time, practice, and the support of those around you, breastfeeding will become easier and feel more natural.
My goal is to breastfeed for the whole year. I never knew that, during this time of me doing, something for him, that I was going to feel so proud of myself, actually. So it's something that's really been, good for both of us.
Okay, so a review of those benefits. We know that the breast milk boosts babies' immune and digestive systems, enhances brain development. Babies that are breastfed, on average, have higher IQ scores and meet their developmental milestones faster. It reduces risk of obesity, diabetes, SIDS, is sudden infant death syndrome, and much less allergies, asthma, and just illness overall, and autoimmune diseases such as Crohn's disease, ulcerative colitis, eczema, just across the board healthier. It is what they're meant to have. And then for the mother, we know video mentioned it reduces the mom's risk of breast and ovarian cancers, heart disease, stroke, high blood pressure, diabetes. So if you were diagnosed with gestational diabetes or have pre-existing diabetes even before the pregnancy, know that you are at higher risk for developing diabetes later in life. So breastfeeding is one of the things that you can do to help counter that. Does make a difference. And it helps you bond and connect with your baby. Overall, women that breastfeed, when it's going well, they have lower risk of postpartum depression and anxiety. And we know that breastfeeding burns 400, 500 extra calories a day. So many of the moms return to their pre-pregnancy size sooner, and it helps with the contraction of their uterus, and they have less blood loss after delivery. So how about any other benefits that you folks have heard of that you want to throw out there, or things that weren't mentioned here that you want to ask about? Is this really a benefit of breastfeeding? There's one huge benefit, significant benefit of breastfeeding that isn't mentioned here, that is a benefit for the family as a whole. It's your breast milk is free. Yes, it's free. Thank you, Kristen. Very good. It's been estimated that just standard formula can cost $1,500 to $2,000 a year. If your baby needs to be on a special formula, it gets even more expensive. And it goes further than just the cost of formula. Women that are breastfeeding, if they're going back to work, there's many less missed days of work because they have a healthier child, less doctor's appointments and prescriptions and ear infections, and all those go into the healthcare costs of babies. So those savings really stretch to just beyond the cost of formula. Okay, we'll continue. Let's watch this video about how the body makes milk.
Breastfeeding really is amazing. Late in pregnancy, your breasts make small amounts of a thick, very nutritious milk called colostrum. This special milk is all your baby needs and is easy to digest, making it the perfect first food for your newborn. In the first few days after birth, colostrum changes to mature milk. You may also hear it referred to as your milk coming in. This mature milk is more plentiful and helps your baby grow and develop. Let's take a closer look at how your body creates this perfect food for your baby. Inside a woman's breasts are milk-making glands called alveoli. This is where your milk is made and stored. When your baby latches onto your breast and starts to suck, your brain sends hormones to the alveoli. Prolactin tells the alveoli to make milk, and oxytocin tells the alveoli to release milk. This release of milk is called the letdown reflex. During letdown, you may feel a tingling sensation or nothing at all. Once the alveoli release the milk, it travels through the milk ducts to your nipple. The milk comes out of the nipple openings into your baby's mouth. The more milk your baby takes from your breasts, the more milk your breasts will make to replace that milk. Your body naturally responds to your baby's needs.
So the big message there is that milk production is very largely based on a system of demand and supply. The more the baby removes from the breast, the more stimulation there is to the breast, the more milk it makes. So your body learns exactly how much milk to make for the baby. Baby is the demander, your body is the supply. Okay. We also know that your milk changes over time. Not just the volume of the milk changes, but the composition of the milk. Your body actually starts making milk during pregnancy, and some of you may have noticed that in the beginning of the pregnancy, your breasts are maybe there's some tenderness, there's some breast growth, and that's because our bodies are amazing, and the breasts are getting signals that there's a baby growing in there, and the whole point of the breast is to make milk to feed the baby. So they start developing. The cells start specializing and differentiating, and the milk is starting to be produced starting about halfway through pregnancy. So when the baby is born, there's actually small amounts ready and waiting for the baby. And there's not much in the beginning. There's not supposed to be much. That early milk is called colostrum, and it's only going to be a couple of teaspoons per feed for the first day or two. And then as your hormone levels change after you deliver the baby and the placenta, and the baby is suckling at the breast, then the volume of milk will change as the baby's creating that demand, and you'll start to make more and more milk. And it'll slowly, after 3-4 days, those breasts usually get firm and full, and we call that your milk coming in. And then that milk is called transitional milk. It looks kind of like white milk, but with a little bit of maybe yellow hint to it. And then finally, about 2 weeks to 3 weeks in, you finally hit the mature milk composition that is certainly more whitish. But the milk composition is changing from the beginning of the feed to the end of the feed. It changes from day one to a month in to several months in, and from the beginning of the day to the end of the day, and based on what you and baby have been exposed to. So it's really very specific from mother to baby. It meets baby's exact needs. It's pretty amazing stuff. And that early milk is called colostrum. Has anybody heard about the other name for colostrum because it's yellow in color? Has a special name because of its high value of protein and antibodies and immune factors. Yes, the golden milk, the liquid gold. Yes, yep. It is a special gift for your little one those first days. A little bit goes a long way. Okay, now we're going to talk about how to breastfeed, some of the mechanics of it. I'm going to watch this video.
Even before your baby is born, there are a few things you can do to help get breastfeeding off to a good start. When you arrive at the hospital, let the staff know that you will be breastfeeding. Tell them that you don't want pacifiers, formula, or sugar water given to your baby unless it's medically necessary. These can cause problems with breastfeeding. Also, let them know that you want your baby put directly on your chest, skin to skin, right after birth and until the first feeding. Skin-to-skin contact is recommended because it helps your baby breastfeed better and for a longer period of time. You and your baby will also benefit from continuing skin-to-skin care as much as possible in the first few weeks.
Like just having that warmth on my chest and having her on my chest is a really good feeling. She was just doing those hunger signs. She's just like moving her head everywhere, just trying to look for something. The nurses definitely did help me a lot, and they just, grabbed her, grabbed me, and she latched on right away.
Another way to get breastfeeding off to the best start is to room in with your baby. Keeping your baby in the same room as you during your entire stay at the hospital allows you to hold her skin to skin and respond to her feeding cues quickly. On the second night, you may notice that your baby is fussier and seems to want to feed more often. Babies do this mainly for comfort, and it's normal and temporary. The American Academy of Pediatrics recommends that healthy, full-term babies avoid pacifiers until breastfeeding is going well and your milk production is established. At that point, consider offering him a pacifier at nap or bedtime to help reduce the risk of sudden infant death syndrome.
The first moment realizing that I can breastfeed it was kind of pretty exciting. And when I say exciting, it's all because of the doctors and the nurses saying, she needs this is what's going to help her, it's going to help her grow.
If your baby was born early or with a medical condition or can't breastfeed right away, your breast milk is still the best food for her. Start pumping your milk or removing it by hand as soon as possible after delivery to protect your milk supply. Ask your nurse or lactation consultant to help.
Here, and now try pushing back and squeezing. There you go. You're doing amazing.
This milk can be provided to your baby in various ways until she is able to feed at your breast.
Okay, so know that Summa does all of these things. And those measures that they discuss, those are all like evidence-based measures that increases the breastfeeding success for moms and babies. So know that those will be routinely implemented for you. A little note on the pacifiers, because I get this question a lot. We don't routinely give out pacifiers at the hospital because we know for moms that are working on breastfeeding, really try to delay introduction of a pacifier for several weeks and until breastfeeding and milk supply are well established. And the reason is because there have been some studies that have shown that early pacifier use can be related to a lowered milk supply from the mother or even latch difficulties. In the first days and weeks, if a baby is interested in suckling on something, we consider that a hunger cue, and we want to offer the breast where the baby is actually getting calories in return for their suckling and is stimulating mom's milk production. We don't want babies to spend time and energy suckling on a pacifier and then miss a feeding opportunity. Bottom line is this is your baby, and if you want to use a pacifier right away, you can. We just want you to know, make an informed decision about that. And that's the reasoning. There's also the concern that some studies have shown that early pacifier use may interfere with baby and achieving a real wide, deep latch at the breast, because if they're on a pacifier, they don't need to open up their mouth very big, and they kind of become accustomed to that. And then at the breast, we're asking them to have a real wide, deep latch. So if we can just stick just with the direct breastfeeding for let's say the first 4-6 weeks, that's the ideal, but I know that's not always possible. We certainly feed the baby if they're not able to feed effectively from the breast. Okay, this little note here talks about a doula. I don't know if anybody's heard of a doula. They are a person that is not really a medical professional, but they are trained to support the mother during pregnancy, labor, and delivery, and they even have what we call postpartum doulas. But they are a wonderful support person, and Summa actually has doulas that are certified that you can look on their website. There's been lots of studies that show that doulas increase the chances of mother having a more natural childbirth and lower the risk of needing a cesarean delivery. They are a godsend. Okay, skin to skin. You're gonna, if you take any of our childbirth classes, or even when you get to the hospital and start have your baby, you're gonna hear the phrase skin to skin a lot, because we know the power of skin to skin. It is like, it works miracles. So, want to watch this video on skin to skin?
Holding your baby skin to skin with no clothing or sheets between you gets breastfeeding off to a great start.
Yeah, we wanted to do the skin to skin because I've read a lot about how good it is for baby, but it's just a really good bonding moment for her to just come right out and be with you right away.
Skin to skin contact triggers the hormones that support breastfeeding. It also helps babies latch on and breastfeed sooner, which leads to a healthy milk supply. Skin to skin keeps your baby warm and comfortable and helps him adjust to life outside the womb, so he tends to cry less and is less stressed. It may even impact his future brain and emotional development. If you have a cesarean birth, ask to have your baby put skin to skin with you as soon as possible, either on your or your partner's chest or held cheek to cheek with you. When you hold your baby skin to skin, lie back and relax with her close to your breast. She may move to latch on by herself, or you can help her.
So know that at Summa, all of our babies, regardless of the parent's feeding choice, go skin to skin right after delivery, because it's really almost a medical intervention. We know babies, as long as they're stable and mom is stable, which is the vast majority of the time, they transition best to life outside the womb when they are enabled to be immediate and uninterrupted skin to skin right after delivery. And we keep them there for at least an hour or two, and if you're breastfeeding, and until they accomplish the first breastfeeding. And then we even tell you in your postpartum state to have babies take naps skin to skin and do lots of skin to skin periods there, because there's so much evidence on the benefit of that, even for their brain development. And we bug the dads to do their skin to skin time too. There are lots of evidence that how beneficial that is for their relationship. We know that it helps keep babies warm. Your body is a heater. And babies do find the breast faster and breastfeed better and longer when they're placed immediately skin to skin. They are programmed to find that breast. You will be amazed at how eager your baby is right after delivery to latch onto the breast. It is survival. Those basic instincts take over. We know skin to skin, in and of itself, even if the baby's not latched and suckling, that contact releases the hormones that are involved in milk production. Babies breastfeed longer when they're skin to skin. It lowers their stress response. It stabilizes their blood sugar level. And of course, the bonding aspect of it. Really, everything is better with skin to skin. It is a medical intervention. Okay. Let's talk about feeding positions. We're going to watch these videos and know that when we talk about positioning and latch, even though breastfeeding is normal and natural, it is still a new skill. It's their first developmental task, and it does take time and practice. Some moms and babies get the hang of it really quickly, and that learning curve is really fast. But other times it can take a little more time and patience for you both to learn this. So just know that it is a new skill, and it will get easier if you are struggling with time and practice and good support. So let's watch these videos.
There are many breastfeeding positions for moms and babies. The main thing is to relax and be as comfortable as possible. Over time, you'll find what works best for you and your baby. Just remember that any position should include these basics. Hold her tummy to tummy with her nose across from your nipple. Support her whole body, not just her head. And be sure her body is in a line, not twisting or turning. In a laid-back position, you recline comfortably at about a 45-degree angle. Place your baby across your stomach with her cheek near or on your breast so she can find your nipple and latch on. Use pillows to keep you comfortable. If needed, support your baby's head with your arm and her feet against your thigh, your arm, or the bed. If you had a cesarean, you can position her in a way that avoids your incision. The cross-cradle position is also helpful for new moms and babies. Lean back a little and use a pillow or a stool if it makes you feel more comfortable. Support her upper back and shoulders with your hand, keeping your fingers low behind her ears. If it helps, you can hold your breast with your other hand. With the football position, hold your baby close in along the side of your body. Use pillows to support your body as needed. This position lets you clearly see how your baby is latching on. This hold can be useful if you have twins, a premature baby, a cesarean birth, or large breasts. In the side-lying position, you and your baby lie on your sides, tummy to tummy. It may take a couple of tries, but once you learn how, this position is great for resting and nursing. Remember to keep all loose blankets and pillows away from the baby. Finally, when your baby has more neck strength, you can use the cradle hold, which supports your baby's head in the crook of your arm. Over time, you'll find your favorite positions, and so will she. Just remember to be as relaxed as possible and hold your baby close into your body so she can get a deep, effective latch.
Pretty girl.
I think for one at a time, I really found cross cradle to be comfortable, and then we kind of evolved to all have one in a cross cradle and one in a football, laying on top of the other.
Well, we had mentioned earlier the demand and supply system in milk production. If we have double the demand, we have double the supply. So know that the body is capable of making lots and lots of milk if we, the messages are there to keep removing more and more milk. So I know of two scenarios now where mother has made plenty of milk to exclusively breastfeed triplets. And if you think out in nature, let's say the mother cat or the mother dog makes the right amount of milk for a litter of 2 versus a litter of 10. Our bodies are pretty amazing. But let's go ahead and practice some of these positions. We're just going to practice a couple of them. Sorry about that. And if you all have like a doll, a stuffed animal, and a pillow, and it'd be great if you practiced along with me. So I had mentioned that first go-to is skin to skin for each and every breastfeed. So If some of the partners are watching this, try to remember that. If mom doesn't remember, babies, if you're getting ready to do a breastfeeding session, unswaddle the baby, get their clothes off, and just leave a diaper on there. But after delivery, if the baby is vigorous, which is most of the time, and mom is doing well, that baby will be dried. The cord will be clamped eventually and then cut, and the baby will be placed immediately on mom's bare chest. You can't wear a bra. Got to have access to the breasts. So, and the baby will be placed like this, just in a little froggy position, just like this on her bare chest. And then we will let the baby take the lead. Some babies start looking for the breast within 5 minutes after birth. Other babies, if they had a little bit of a longer pushing phase or rougher labor and delivery, it might take them 60 or 90 minutes to start to have the energy and the signs to look for the breast. But we want to let the baby take the lead, and then, help them to the breast once they show us those cues. So the baby may start doing hand to mouth movements. They may start thrusting the tongue, smacking the lips, and then actually bobbing their head up, and everybody's going to be like, oh my God, that baby's so strong. It's like, oh yeah, that baby's trying to find its food source. So babies will, move. They're driven by their sense of smell right after delivery, and the areola, the nipple, and the colostrum, that early milk, is in chemical composition very similar to the amniotic fluid. So it's kind of natural for them. They are driven to that. And so if we notice that the baby is, let's say, kind of bobbing over and trying to find the breast, I will have the mom oftentimes lift up her breast like this, and I'll help her support the baby with her arm behind the neck and shoulders. And then we'll have the baby's head a little bit below the breast. And if we just do that, many times the baby will self-attach. And that's really the ideal, that they have that moment of learning, and they kind of they self-attach on their own. If the baby really seems to be struggling and trying and then worried about that the baby is just fatiguing because they're not getting it on their own, then by all means, we might have the mom, when the baby's mouth is open, help feed the nipple and areola in there. And of course, your labor and delivery nurse will be helping you too. But mom is kind of laid back, and many times her hand is supporting behind the neck and shoulders, and the other arm might be, hand might be bringing up the breast, and the baby approaches it from below. And then once they're latched, many times I'll have the mom bring the arm around, and this is where the partner can also help place some pillows, or even get a pillow for mom on the other side. I tell the partners, I always get them involved. So if you see me in the hospital, know that I'm going to involve you in the breastfeeding session, and using pillows, and build a little nest for the mom and baby, and make sure she's got whatever environmental supports that she needs to be comfortable. And then the baby opens wide and latches on, and we let that baby feed for as long as they want to. We call this laid back breastfeeding because the mother is laid back. The baby is actually prone on their belly with one arm on each side of the breast, but the nose is free and the cheeks and chin are tight against the breast. Don't be surprised after delivery if your babies usually feed fantastic after delivery, and they may want to feed for 30, 45, or 60 minutes. They take a long feed at that time and let them go as long as they want, because then they're going to hit the recovery sleep, and it may be many, many hours before they're interested in feeding again. So getting that breastfeeding accomplished within the first couple of hours after delivery is really important. If for some reason your baby just won't latch after delivery, at the very least, we're going to assist you with hand expressing and giving them drops on your finger or on a spoon, and getting that milk production stimulated and getting those hormones released to build a supply. But full-term healthy, vigorous baby, most likely they're going to latch, and that's our goal. So that's the laid back. It is more of the baby-led position. That's good for newborns. Another one that I suggest for the newborns is something called the cross cradle hold. So in this position, mom would be sitting up pretty straight up. You can do this in a chair. You can do this in one of our beds we have, mechanical beds you can put the back up real far. But then the baby, of course, is going to be skin to skin, right, for each and every breastfeed with just their diaper on. And if we're going to be offering the left breast, I would have some type of a pillow, or if you bring a boppy in or one of those My Breastfed things, we have to create a shelf for that baby to lay on. So we want that right below the breasts. And we have the baby completely on their side facing the breast, ears, shoulder, hips in alignment. And then I instruct the mom to hold the baby with the opposite arm of the breast that they're going to feed on, kind of with their forearms supporting baby's back, and then a nice clutch behind the baby's neck and shoulders, not behind the head, neck and shoulders. And maybe they can have like a mom's finger coming up the side here, but the baby needs to tilt their head back. And we have for baby one arm on each side of the breast. And then I have mom, whoops, I like the breast going this way, scooping up the breast from underneath, I have my hand more in a U shape as opposed to this is a C. If we do this, we're trying to feed the hamburger in sideways. That doesn't work out as well. If we do this U, we're molding this breast into feeding the hamburger the right way. And we would start with that nipple across from the baby's nose. And then we wait till the baby opens their mouth and tilts their head back. And when he does that, then we quickly bring the neck and the shoulders in. We never forceful, but we can be helpful and we can help guide the babies. Lead with the chin, bottom lip hits the underside here. And then as we continue to guide baby in, you can use your thumb here to help flip or feed the areola and nipple into the baby's mouth. And so then the baby, when they're latched, it looks like this. The neck is nice and extended in what we call kind of a sniffing position. That facilitates swallowing, and that leaves the nose free for breathing. Once the baby's latched and going well, if mom doesn't have real large, heavy breast, then I tell the mom I assist her with bringing that arm around so the bicep kind of supports the breast. We get even more pillows there. I have dad. I always put dad to work, put an extra little support underneath here, and then he records what breast the baby's on and when they started the feed. And we let the baby feed for as long as they want to. And that's called the cross cradle hold. It's great for the newborns because you have good control over the baby's neck when they're a learner. The other, and of course, if you're doing it on the other side, it is, it's exactly opposite here. Same thing, just opposite. Other hold that I want to talk about is something called the football or the clutch hold. You may have heard about this. We're going to demonstrate on the left breast because that makes the most sense right here. And the football clutch hold, we would have a support, a pillow or something up on the side of mom. She's in a full sitting position. Of course, we have this baby skin to skin, baby showing us cues. The obvious signs the baby wants to eat. I have the mom hold the baby in a clutch again with the forearm against the baby's back, and this hand nice and low behind the baby's neck and shoulders. kind of very similar to how we did in the cross cradle, that same type of a hold. And then they can kind of come in from the side, and then I have the mom scoop the breast kind of in a U here, and then we start with the nipple across from the nose, and then when the baby opens their mouth, again, we lead with the chin, we guide the baby into the breast, and then we can use our thumb to help flip or feed the breast tissue deep in there. So when the baby's nursing, it kind of looks like this. And I usually tell the mom, hang on to your breast for this time because, or we need to have some type of a rolled up something to support the weight of the breast. The breast is your baby's bottle, so we can't, and it has weight to it and there's gravity out there. So we can't just, once we put it in the baby's mouth, expect them to do all the work of supporting the weight of the breast in their mouth, especially when they're newborn. So either our hand or some type of a pillow under there to help support the weight of the breast, and we let the baby feed for as long as they want to. The football hold, again, is great for newborns because the mother has control over the neck and the shoulders to help feed the breast tissue into the baby's mouth. Many times we see parents who want to start with just this more traditional classic cradle hold. If it works for you, that is fantastic. But the reason we kind of reserve this for babies that are a little more experienced and older, good with breastfeeding, is because in this more traditional cradle hold, we don't have good control over the head and the neck, and it sometimes is challenging to get that baby latched well and deeply. So, but the right position is what works good for you and your baby, where you're both comfortable and the baby's transferring milk efficiently. That's the right position. Those are just some suggestions. Okay, we're going to go back to the PowerPoint here. Sorry, need to advance my slides a little bit. Oh, there we go. So we're going to watch this video on latching here. I did talk a bit about latching when I was doing the positions.
The most important part of breastfeeding is knowing that your baby has a deep, effective latch. An effective latch allows your baby to get more milk and you to be more comfortable. Many babies latch on easily when mom is leaning back and relaxed with her baby on her torso, sometimes called a baby-led latch.
And then you can take away this hand and you can support his head and your breast with this arm and shoulder.
When you're leading your baby to latch, lean back slightly so you are relaxed and comfortable. Hold your baby close into your body with her tummy facing yours. Place your baby so her nose is right across from your nipple. Keep your hand behind the areola, the dark area around your nipple. You can interest her with a drop of expressed milk. Tickle her upper lip. When she opens her mouth wide like a yawn, pull her in quick and close. Look for the signs of a deep latch when you breastfeed. Your baby's mouth is open wide, her lips are flared outward, and her chin is pressed into the breast. You should be able to see more areola above her mouth than below. Your baby's ear and jaw should move when she sucks. You'll feel a pulling or tugging that's not painful, and you may be able to see and hear her swallowing. With a shallow latch, only the nipple or a small amount of the breast is in the baby's mouth. You may feel biting and pinching, nipple pain, and you may hear clicking or smacking sounds.
And then when she opens up her mouth wide, then you can just bring her in nice and quick.
In the early days, it may take some time and practice for your baby to latch on correctly. If your baby has a shallow latch, you'll need to re-latch. Break the suction gently to protect your nipples by pushing in on your baby's cheek or inserting a clean finger in the side of her mouth. Be patient with yourself and your baby. The more she breastfeeds, the better she'll get at latching on. If you have problems breastfeeding, talk to your nurse or a lactation consultant. They can help find the cause and a solution.
Relax your shoulder.
So this is all the components of latching on and everything that I talked about while we did that positioning. When have our baby skin to skin, have them completely facing us, lift up our breast, have plenty of space with our forefingers below the areola, just like shown in that little video. Start with nipple across from the nose. We have to wait till the baby opens up wide and then bring the baby quickly into the breast, leading with their chin and help guide breast tissue deeply in there. It should look like they're biting into a hamburger. We call it breastfeeding, not nipple feeding. So, review of all the components of an effective latch. That mouth is open up wide. Those lips, both top and bottom, are everted or flared outward, kind of like a fish. Of course, there's a large amount of breast in the baby's mouth, not just the nipple. Oftentimes, there is more areola showing above the baby's lip than below. It's kind of not a perfect bullseye. It's a little bit off center. They have more of the underside of the areola in their mouth than they do on the upper side of the areola. There is wide jaw movement. You can feel the suckling, which should be an obvious you're going to know the baby's suckling, but it shouldn't be toe curling pain. And as your body makes more milk, you should be able to hear the swallows. When you're at the hospital, we'll be talking about seeing the swallows and maybe even hearing them. Sometimes we can. Should not be painful for you. And then when the baby comes off of the breast, that nipple, it might be a little bit elongated, but the nipple tip of it should be rounded and not pinched or compressed or look like flattened or look like a used tube of lipstick. An ineffective latch is everything that an effective latch is not. You can see the baby is clearly just hanging on to the nipple. This baby is not going to be getting much milk, and mom is likely going to be experiencing pain and nipple damage. This is not effective feeding. This is a baby pacifying on a nipple. You may see dimpling of the baby's cheeks when they do this. You might hear some clicking sound. The breast doesn't soften after the feeding because they're not effectively removing milk when they're doing this. The nipple may look pinched like we talked about. And again, sore nipples and baby isn't transferring milk. Okay, watch this animation. I know we obsess on latch, but we obsess on it for a reason because in the beginning days, a good latch is the key to effective breastfeeding.
This animation shows what a deep, effective latch looks like. With his mouth open wide, the baby comes to the breast chin first, with his head tilted back. He latches on so that the nipple is drawn far inside his mouth all the way to the soft palate, which is very flexible. Here, your nipple can expand and the milk can flow without causing pain. With his tongue above his lower lip and under the breast, he sucks quickly, which helps trigger the letdown reflex. When the milk starts flowing, his sucking becomes deeper and stronger. He settles into a rhythm of suck and swallow. A deep, effective latch allows your baby to receive more milk and you to be more comfortable. With a shallow latch, however, the nipple is not far enough inside the baby's mouth. When it only reaches the hard palate in the front of baby's mouth, the nipple gets pinched. This can damage the nipple and result in your baby getting less milk.
And if we don't remove milk, what's going to happen to the milk production? No milk removal? Yes, thank you. It produces less. Little phrase we say, remove it or lose it. So you got to keep removing milk to keep making milk. So let's talk about how we know for breastfeeding when to feed our baby. What we advise is on-demand or cue-based breastfeeding according to the baby's behaviors. So we're going to feed our baby whenever they're hungry. And babies, although they're not, you know, speaking words to us, they are communicating very well through their behaviors and letting us know they're hungry. And we'll be talking about those in a minute. But overall, our baby should be feeding at least 8 times every 24 hours, and this is going to include in the night. And yes, this is a lot, but newborns need to feed frequently. Even babies that are being bottle fed, they need a couple night feedings. That those babies are going to be feeding, 7 to 8 times in 24 hours, usually starting at 8 times in 24 hours. Breastfeeding, it is a little more frequent because they take smaller volumes, but it is the more natural way to feed when they're just small volumes a little more frequently. It's better for their GI system when they feed that way. We want to let the baby stay at breast for as long as they're actively suckling and swallowing. And when the lactation consultants and nurses visit you and we, evaluate the breastfeeding, we're going to talk about that. You can also use with your hands some massage and compressions on the breast to help with the milk transfer. And some folks may have heard of the term cluster feeding. And this is when there are very frequent feeds over the course of 2, 3, 4 hours where the baby just is constantly feeding and seems insatiable. Know that this is normal and necessary. They're doing it to drive up mom's milk production. Sometimes we see that happen on the second night. Know that it doesn't last forever, and they know what they're doing. And there'll be more periods of cluster feeding as baby goes through growth spurts. They're creating, telling mom's body, hey, I need more milk. So feeding cues. This is when we feed the baby, when they're giving us these cues to feed. Great thing for the support person to do is monitor the feeding cues.
It's important to try to breastfeed baby at the earliest signs of hunger. Baby is so much more patient when they're not that starving, and you can get a much better latch. But when baby is fussy and crying, it can be a lot more difficult.
Keep your baby near you day and night so you can feed her as soon as you notice her feeding cues. These are movements and sounds she makes when she's ready to be fed. An early feeding cue is fidgeting. She's probably going to be ready for her next meal soon. Another early cue is the rooting reflex when she moves her head back and forth, looking for a breast. You might also see her make sucking motions with her tongue and mouth, or bring her hand to her mouth. As he gets hungrier, he will move his arms and legs as he becomes more agitated. Finally, a hungry baby will start to cry. It can be hard for a crying baby to latch, so try to feed your baby when you see her early feeding cues. You can also pay attention to your own body to know when it's time to feed your baby. When your breasts feel full, it's probably time to nurse.
Okay, so we try to catch the early hunger cues so the support people can look for that. If we get to where the baby is really fussy and disorganized, it is a lot more difficult to get them latched successfully. And sometimes they get to the breast and then they're just so exhausted because they, just had a crying spell, and then we kind of missed a feeding opportunity. So partners and moms, pick up on those early cues. Okay, big question. How do we know the breastfed baby is getting enough? My overall answer to this, I'd like to remind people, we're all here because breastfeeding works. So The human race survived on, breastfeeding for, all of our history, with the exception about 100 years ago when formula in bottles and breast pumps were introduced. Prior to that, our ancestors were breastfed and we all survived. And if it was our, own mother that had difficulty making enough milk or wasn't there, or, then it would have been an aunt, a sister, somebody in the community, a wet nurse that would take over and breastfeed the baby. So we're designed to make enough milk for our babies. So most of the time it does work, but there are some signs that you need to know, to look for, to make sure that it's working out for the two of you. Okay, so let's watch the video to explain some of these.
One of the things to listen for while baby is breastfeeding is audible swallowing. So you should hear baby swallowing lots of breast milk, and also the latch should be pain-free. So it should be very comfortable for mom. You can look for plenty of wet and dirty diapers in 24 hours, and baby can have frequent weight checks, and often that shows that baby is gaining enough weight.
Many new moms wonder if their baby is getting enough milk. One way you can tell is if you see and hear your baby sucking and swallowing milk once your mature milk comes in. You may see her ears or jaw moving.
Hungry little girl.
Also, notice how you both feel after a feeding. Your breasts should feel lighter and softer, and your baby should seem content and satisfied, not fussy or showing hunger cues. A baby who is getting enough milk should also have several periods of being awake and alert during the day. Another way you can tell if your baby is getting enough breast milk is by keeping an eye on how many wet and dirty diapers they have each day. A breastfed baby's first stools, called meconium, will be black and sticky. From day 3 to 4, her stool will change to a greenish-brown color. Then from day 5 to 6, they will be yellow with a loose, seedy texture. By day 5, a breastfed baby should have at least 6 wet diapers and 4 stools every day. It's common for breastfed babies to have a bowel movement after each feeding in the first few weeks. After this, a breastfed baby may have fewer stools. It helps to use a feeding and diaper log to track her feedings and diapers. You can use a digital log or track feedings and diapers on paper. Finally, your baby is probably getting enough milk if you feed her about 8 to 12 times every 24 hours.
We'll go ahead and weigh her before and after the feeding, and that'll tell us.
If you're concerned your baby isn't getting enough milk, have her weighed. In the first day after birth, it's normal for babies to lose a little weight. By 10 to 14 days after birth, your baby should be back to her birth weight. After that, the average baby gains about 5 to 7 ounces every week until the end of the 2nd or 3rd month.
So she's gaining really quickly now. It's nice that they'll gain a half an ounce to an ounce a day.
Call your baby's healthcare provider if she seems very sleepy and needs to be awakened to feed, or sleeps through the night, does not have at least 4 yellow stools per day by day 4, or 5 wet diapers per day by day 5, has a reddish-orange stain in her diaper, which is a sign of dehydration. If her stools suddenly change, she's not gaining weight. She acts hungry after feeding or has short feedings. Your breasts aren't fuller or firmer by day 5. Her skin or eyes become yellow, which is a sign of jaundice. Or she breastfeeds fewer than 8 times in 24 hours. Contact a lactation consultant or your baby's healthcare provider if you are concerned that your baby isn't getting enough to eat, and before you think about giving her formula.
Is it okay if it's sporadic, like sometimes it's 20 minutes and then other times it's like 45 minutes?
Those sound like normal
It's
time
okay.
frames for a baby to eat, yeah.
When a baby gets formula, even in small amounts, it reduces the time spent breastfeeding, which can affect your milk production. Most breastfeeding issues can be solved quickly when caught early on.
Okay, so the video talked about all of those points that are listed down there, so I won't reread all of that. Here's a little chart on the diapers. At the hospital, we give you a paper log, and I usually put the partner on this task to record all of the feedings, what time the baby fed, what side, and how long they fed for. And then for each and every diaper change, whether it's wet or whether it's poop, you record that, because that information then is you'll be telling your nurse that information, and they transfer that into the baby's electronic medical record, because eating, peeing, and pooping it's important business for a baby, and it is a sign of health. So but for the baby who's breastfeeding, I would say even after you go home, for maybe the first week or two until things are going well, that you continue to track the feedings and diaper changes to make sure you're hitting these parameters. One popular app for that is Baby Tracker. The Huckleberry is another great app for tracking. Of course, you can always do paper and pencil, whatever works for you. But tracking in the beginning for breastfeeding babies, I think is helpful. When you go to the doctor, they are going to be, asking you, how many wets did you change yesterday? And, it's nice to have that information all in one area there. Okay. And weight loss and weight gain is another way that we know that the breastfed baby is getting enough. All babies, or the vast, vast, vast majority of babies, regardless of feeding method, breast or bottle, they lose weight in the first 2, 3, 4 days after delivery. They can lose up to 70% of their birth weight. We expect that. We'll be weighing them at birth, obviously, and then we'll weigh them every day that they're in the hospital. So expect those drops of several ounces each day. It will be important for the baby to be seen by their pediatrician or family practice doctor, whoever their follow-up provider is, within 1 to 3 days after discharge from the hospital. The pediatrician in the hospital that's following your baby, who may not be the doctor who the baby is going to afterwards, they will let you know specifically when the baby is to be seen after discharge. Sometimes they want the baby seen that very next day. Other times, let's say you're discharged on a Friday, they might say it's okay to wait in for the baby to be seen on Monday. It just depends. So don't go ahead, and, once you have the baby, like, oh yeah, we have to make that appointment. Let the pediatrician at the hospital following your baby give you some guidance on exactly when, but expect it to be within 1 to 3 days, because we need that weight check to make sure that baby hasn't lost more than 10% of their birth weight. Baby should be back up to their birth weight, just their birth weight, by 10 to 14 days after delivery. And then they should be gaining after day 5 of life, and then they gain about 5 to 7 ounces a week for the first few months of life. So appropriate weight gain is another way, we know that they're getting enough. It's important for you to have those regular visits with a pediatrician for those weight checks. And of course, you can always come into our support group. Just like the earlier video showed, we do pre and post feed weights, and it's a free, easy way to get your baby's weight checked and see how much milk they're transferring at the breast. So the video went over these of the reasons to call your baby's healthcare provider. Obviously, you're, err on the side of caution with a newborn. Don't think they always have a pediatrician on call around the clock to, answer questions. Sometimes, they may say it's fine to wait till bring the baby into regular office hours the next day, or sometimes they may say, these are concerning, I want you to bring the baby into an urgent care or the ER or something. But these are things that the video talked about that you would need to look for. So. Okay, let's talk about the mom side of things and your breast care when a woman is making milk. This little quote says, "My milk changed the night we came home from the hospital, and she ate very enthusiastically after that." Even though we have milk ready and waiting for the baby right at the time of delivery in the first few days, those breasts in the first days are still going to be soft because it's just the small volumes of colostrum. The milk coming in, or the significant change of the fullness and the volume of the breast, for a first-time mama, that can happen anywhere from 2 to 5 days after delivery, but it should happen no later than 5 days. But it often happens after you're home from the hospital. It's an important thing to look for, to know that, oh yeah, there's a difference here, and now we're really hearing gulping and swallowing at the breast. Okay. Breast fullness is normal, so there we go. Know that about around 2 to 4 days after delivery, your breasts are going to become significantly fuller, firmer, heavier, meaning that your body did what it's supposed to after you have a baby. That increase in milk volume has occurred. The milk is more plentiful. It's going to look more whitish, more creamier. When this happens, there's not only extra milk there, but the breast, there's all the kinds of extra fluids and swelling just in the tissues, and extra blood flow, and an extra fluid that is known as lymph fluid. And it can be uncomfortable, overly full. So to help manage that, we want to feed the baby frequently. If they are being really sleepy and those breasts are like really full and getting uncomfortable, and you want the baby to feed, but let's say they just, it's too sleepy, won't latch for you, then you could hand express a little bit, or even get in the shower and let a little bit of the milk passively leak out, and then put a bra on. Even starting from the hospital, and especially once the larger volumes of milk come in, start wearing a nursing bra around the clock. You need those breasts to be supported. Otherwise, you could really get a lot of edema or extra swelling or fluid collection in the lower portions of your breast, or even in the areola, which could make it hard for a baby to latch, and it'll be a lot more comfortable. So they need to be well supported. So look into a high-quality nursing bra. Okay, hand expression. Let's watch this video first.
The following steps are one suggested way to hand express your milk.
Hello, Miriam.
Hi.
My name is Nikki. I'm a lactation consultant, and today we're going to go through hand expression.
Okay, thank you.
So, Miriam, let's start with hand massaging of your breast, and that helps get your letdown going. The easiest way to massage the breast at the beginning is by doing small circles around the breast. So to hand express, Miriam, you would put your finger and your thumb on the sides of your areola, about 1 inch away from the nipple. That's it. And then you would compress into your chest wall without stretching the skin and bringing the fingers together.
When you squeeze, try not to pull or slide your fingers along your breast or nipple. Push back, compress your breast, and relax several times in this position.
In, compress, relax. Can you see how the flow is coming now? So not only are you increasing your production of milk, but you're creating a very soft base for your baby to latch onto.
Repeat compressions over and over in a rhythm. It may take a few minutes for you to release milk.
Would you like to try that on your other breast with the massage first?
Move back and forth between breasts often as your milk lets down and starts to flow. At the beginning, you may get less than a teaspoon. As your mature milk comes in, you will get more. You can catch the milk with a clean spoon, jar, or wide-mouth bowl and feed it to your baby. Hand expressing your milk after every feeding in the first few days can lead to a noticeable increase in milk supply for your baby. It's an age-old skill that is shared by women all over the world.
So in the hospital, we will be teaching you practicing hand expression because it is an important skill for all breastfeeding, pumping women to know. It's great for so many reasons. It can tell your body to make more milk sooner. We talked about demand and supply. Baby's the primary number one demander, but those hands, hand expressing drops can also provide extra demand and tell our body to bring in the milk production, accelerate that milk production. It's great for when you're latching baby to have a drop or two ready and waiting for that baby. If you're overfull, that's what I talked about. You can hand express and just release just a little bit of milk for things or more comfort. You don't need to get a pump out, just a little bit of hand expression, and that's so much easier and oftentimes more effective for releasing milk. Helps, if you're overfull and you do the hand expression, then moving a little bit of milk out of there is going to help you prevent engorgement. It can help soften the breast so the babies can latch on easier. And we use it when moms are pumping because we know we have a phrase, the hands can do what the pump cannot. So if we use our hands when we're pumping and hand express afterwards, we have more thorough emptying of the breast. So we'll be, and if baby's not latching, we're going to start with hand expression and giving them the milk on drops on our finger or on a spoon. There we go. So talked about, when the milk first comes in, day 3, 4, and the breasts get overfull. It's kind of like the breast being full is a little bit on a continuum. In an extreme case of the fullness is what we call engorgement. Not every woman experiences engorgement, but it can happen sometimes when the milk first comes in, or if there's a long period between when you've either nursed your baby or pumped or removed any milk. And it's best described as the breasts are swollen and tight and shiny and hard and painful, and they actually feel like hard, like like your chin or something. They are hard, and again, it's not just milk in there; it's all kinds of extra fluids. And when we have engorgement, sometimes the milk is things are so swollen that the milk ducts are kind of pinched or squeezed shut, and we can't, the milk is like trapped in there, so it can be really uncomfortable. To relieve, if you think you're experiencing engorgement, what we would tell you is before you're going to feed the baby, use some hand expression, some gentle massage. That can help move the milk a little bit. Some warm, wet compresses for maybe just a few minutes prior to feeding, getting in the shower, letting the warm water with a little gentle massage help dilate those milk ducts. A little bit of milk might start to flow. And then if you are experiencing engorgement, we really encourage you to try to get the baby to feed on both sides every feed, just so we get milk removal from both sides. Generally, we'll tell you, let the baby, if we're not having engorgement, let the baby feed for as long as they want on the one side, which could be 10, 15, 30 minutes, and then offer the second side, but it's not imperative that they feed on both sides. It just depends on your baby and how hungry they are. If we're having engorgement, I would say really try to get the baby to feed on both sides so we get a little bit of milk removal. So in that case, we would, after the baby's fed for maybe just 5 or 10 minutes on one side while they're still interested in feeding, I would break the suction, take the baby off, and make sure they give you some relief on the other side if we're experiencing engorgement. After feedings, we would use large ice packs for 15, 20 minutes at a time, a supportive bra, nothing too tight. You want to use like an Ace bandage, something that's binding, but something that is going to be very full coverage, like a sports type bra. And then if it's okay with your doctor, you can also take anti-inflammatories, ibuprofen. You can alternate that with Tylenol. But the ice is the biggie and you can repeat that 15 to 20 minutes of ice every hour. You just don't want to use ice just prior to latching the baby. That's where you would want to use maybe a little bit of warmth. Okay, let's go on to nipple care. Watch this video.
In the first few days, you may feel some nipple tenderness when your baby latches on, but breastfeeding should not be painful. If you feel discomfort longer than 30 to 60 seconds, gently break the suction and try a new latch or a different position. Check that your baby has a deep latch and is taking in milk. Get help if the pain doesn't go away or if your nipples look damaged. Get help right away so you and your baby can have a long and successful breastfeeding experience.
The biggest thing that mom can do to take care of her nipples is to ensure a deep latch. If it feels painful at all during the feeding, mom should break suction and try to get a deeper latch.
Okay, so, deep latch again, proper latch is the key to successful breastfeeding. This little picture shows you how to break the suction. You need to push into the corner of the baby's mouth before you try to move the baby away from the breast, because most babies, when they sense that they're being removed from the breast, their kind of suck reflex will kick in and they'll grab down right away on that nipple, and that could really, hurt you. So get your finger to the corner of your mouth. That's a great thing for the support person to help you with. I show dads how to do that all the time. Your breast, very mild soap, and when you're taking a shower, and just make sure all the soap is rinsed off of them. You don't need to clean your breast before the baby latches on there. Your nipples and breast areola has glands in there that secrete substances that keep them lubricated, and it's anti-infective, and it guides the baby to the breast. So we don't want to, wipe that all away. And actually, we've learned that babies prefer the unwashed breast over the washed breast. So don't think that, oh, I need to put deodorant on and I need to make sure, I smell good for my baby. They think your natural scent is really quite wonderful. So breast pads, we don't want to overuse those too much, because sometimes they have been associated with getting infections on the breast. And if you feel like you're always a kind of a leaky sort, then go ahead and use the breast pads when you're going out. Of course, obviously, hand washing is important. Your own breast milk makes a wonderful nipple ointment, and it's right there ready to go. It has anti-infective properties. They use breast milk for so many things, so you can hand express, if your nipples are sore, onto hand express some of your milk and just kind of let it air dry. There are nice nipple ointments out there. You don't have to buy a nipple ointment, but if you are going to, Mother Love, Earth Mama, those are all good ones. There's Lancino, that's the more traditional lanolin-based nipple ointment, but we're learning that lanolin, even though that in the past that was what was primarily used for sore nipples, some women have a sensitivity or allergy to lanolin, so now there's a lot of lanolin-free organic nipple ointments out there, and I actually prefer those. Know that nipple soreness is very common in the first days. Your nipples aren't used to this, but toe curling pain, dreading putting the baby to the breast, and obvious nipple damage, cracking, blistering, bleeding is not a normal part of breastfeeding, and please get some help for this. Okay, spoiler alert. Yes, nipples come and breasts come in all shapes and sizes. So, and people have, somewhere in between all of these. The protruding nipple, which you've seen, they picked, lovely breast and lovely nipples for these videos. But it does make it easier for the baby to latch if the nipple is naturally protruding. Sometimes we can make that happen with just a little bit of manual hand stimulation of rolling and gentle stretching of the nipple, and it'll kind of protrude right out there. But babies, if you do have inverted nipples where they're kind of almost dimpled in, we see it all the time. The great likelihood is those breasts will produce plenty of milk, and babies can learn to latch onto inverted nipples. It just might be a little bit more of a learning curve. So they're more common than you might think if you are the owner of inverted nipples. So do not be concerned. We'll just, talk to you about it when we see you at the hospital. They do pop out over time. And then there's flat nipples where they just need a little bit of stimulation or rolling, and they'll pop out of there. So regardless of where you fall in this, the great likelihood is your body will make plenty of milk and the baby will learn to latch onto there. Okay, reason that the woman would need to call her OB provider or lactation consultant or a breastfeeding medicine doctor, we have those now, is if it's day 5 after delivery and you don't think your milk came in. Important, partner, if you can remember this, that there should be a significant difference, because sometimes there's situations that for whatever reason the milk doesn't come in, and if we're only relying on mother's body, to feed the baby, then we're concerned that the baby might not be getting enough to eat. And we remember that the number 1 rule is feed the baby. If you have engorgement, tight, hard, shiny, painful breast that's not relieved in 48 hours, then your milk supply, baby's not getting milk for one thing, and your milk supply could be affected too, because we got to move the milk out of there. So please seek help. Mastitis refers to inflammation of the breast, and sometimes that can be an infection. So if you experience a painful, firm, red, hot area on the breast accompanied by flu-like symptoms, please call your OB provider. They will likely start you on antibiotics. Keep breastfeeding or pumping, keep removing milk from the breast. Otherwise, you will lose your supply. And babies, it is absolutely safe and recommended for babies to continue to breastfeed if that's possible while you have mastitis, unless you're hospitalized. Antibiotics are absolutely compatible with breastfeeding. The vast majority, unless you have a premature baby, there's a few of them we need to stay away from. If you have ongoing nipple or breast pain or nipple damage, reason to get help. That is not a normal part of breastfeeding. If you're concerned about your milk production or baby's ability to breastfeed, seek help. The sooner you seek help, the more likely the interventions can make a difference. If we're getting 2, 3, 4 months out, then it is harder for the interventions to make a difference, because our body's ready to make milk. We have a window of time within the first weeks after delivery. If we don't act on problems then, things get a lot more challenging. Remember, milk production is a system of demand and supply. If there's no removal of milk, eventually production will cease. And that can happen within a couple of days, that the breast will become engorged, and then eventually there will be what we call involution of the milk-making cells, and then they will become soft, and it will be very difficult to, challenging and a lot of work to make milk again. If you suspect a tongue tie, people have maybe heard of this. A tongue tie is where the tissue that is on the underside of the baby's tongue, for some of them, there can be some very a thin membrane that extends to the tip of the baby's tongue, and it can make it hard for them to thrust their tongue all the way out of their mouth. It can also make it difficult for them to elevate their tongue and do the necessary wave-like motion for transferring the milk. So we should be checking for this at the hospital, but things, could get missed. So if you suspect that, oh, there's this little vertical band of tissue, and when a baby cries, the tongue looks like kind of heart-shaped at the top, then please reach out to us. Okay. Yes. Very good. And the breastfeeding lifestyle. Okay. What the recommendations are now. In a much earlier video, I don't know if you folks remember this, but the video said the American Academy of Pediatrics recommends breastfeeding for the first year of baby's life. Well, they do, but they recommend it for even longer now. They have changed the recommendations, but that video has not been updated. So if to continue breastfeeding for the first 2 years of the baby's life is what is now consistent. It's their recommendations and what the World Health Organization says, as well as the CDC. Know that when you're breastfeeding a toddler, it is not 8 times a day and waking up in the middle of the night to breastfeed. It is maybe once or twice or 3 times a day. And that milk still has the immune components of it. It's still benefiting their health, and it's still free milk. So it doesn't look anything like that breastfeeding the newborn. So for the first 6 months, we only want breast milk, and if it's not only breast milk, then it's formula or breast milk, no solids until about 6 months, and the baby is showing signs of readiness for solids. As we introduce solids one by one, and your pediatrician will give you guidance on that, we still breast milk and or formula is going to be the bulk of their diet, 2/3 of their diet. So solids are important, but the breast milk, the milk comes first. And then, when they're about a year old, then the solids are more of their diet, and then the milk is, secondary. So, but it's still beneficial for them. So that's the most up to date. The longer you do it, the greater the benefits, and it's always free. Okay, so let's watch this video on partner support.
Along with time and patience, all new mothers need emotional support from their partners and families while they learn the art of breastfeeding.
Done. There you go, all nice and clean.
Sugar pea. Partner support is critical to breastfeeding success.
Breastfeeding is really great for our baby because it's a natural way for her to get all the nutrients and food that she needs. And really, I think that's the best thing for her.
Studies have shown that mothers are more likely to succeed at breastfeeding when their partners show their support. Partners, your attitude about breastfeeding directly affects mom's success. Reassure her that she can do it, especially during the early weeks. Help her get comfortable when it's time to breastfeed, and suggest professional help when needed.
When I was breastfeeding, Dan would get me a little snack and a glass of water. And even in the middle of the night, he would come and I would go and nurse in the nursery, and he would just come and lay on the floor. And so even though he was asleep, it felt good to know that I wasn't all alone in there.
breastfeeding may take some time to master, but mom and baby's health is worth it. Connect with your baby in other ways, like holding her skin to skin, massaging her, and helping with all of the other parts of having a newborn. Partners, friends, and family can also show support when it comes time to breastfeed outside of the home. It's easy once you get used to it. Just find a comfortable place to sit down and nourish your baby. You can cover up if it makes you feel more comfortable. Every state protects your right to breastfeed in public.
Okay, so throughout this presentation, I've been mentioning the many things that the partner can do. You know, the hunger cues and making sure that she has the pillows and something to drink and tracking the feedings. And many times, even at the hospital, it's the partners that are calling for the lactation consultant, or all the time at our support group, it's the partners that are bringing mom and baby in and helping them, you know, find the place and get settled. Or we have a breastfeeding hotline number, making the call for them. So, you know, your support is a game changer. Women that breastfeed successfully and for long periods of time, a key factor is a supportive partner. And because the woman is choosing to do this, the partner is going to benefit from a healthier, um, healthier mom. Their partner is going to be healthier and a healthier, smarter baby, and saving a lot of money. So it is huge, your role in this. Oh, I want to touch on substances of concern, because this is a very common question that I get. Know that most, but not all, medications are compatible with breastfeeding. So it is important that if you're prescribed something, you need to check with the pharmacist or your OB provider or lactation consultant. If somebody tells you that you're going to have to, you can't take that medicine, or you're going to have to, what we call pump and dump, pump your milk and discard it, or, you know, you have to switch over to formula, get a second opinion. Those medications are few and far between, and it could just be that somebody isn't, you know, up to date on the, you know, latest evidence with safety of breastfeeding and medications. Alcohol. Certainly the ideal scenario is that you don't take in any alcohol at all when you're breastfeeding, but if you choose to, I would say make this after the baby is at least 3 months old, so they're not so small and their liver is a little bit more mature. And if you do choose to have a single drink, then time that for just after breastfeeding or just after pumping, so that your body has 2-3 hours to metabolize that alcohol before it is time to either pump or breastfeed again. Evidence shows that if we wait a couple of hours, if the alcohol intake has been just one serving, one beer or 1 4-ounce glass of wine, or like an ounce of hard liquor, then waiting 2-3 hours is sufficient. You don't need to pump and dump. Of course, if you've overdone it, and those breasts are very full, then you might want to pump and discard your milk just one time. But you don't need to, you know, go for like the next 12 hours or whole day and pump and discard your milk. Cigarette smoking is, you know, if you're a smoker, we tell you please breastfeed. Even more reason that you should breastfeed, because having the mom who's a smoker or a smoking parent or anybody a smoker in the household does increase the risk of SIDS and allergies and asthma and respiratory issues. So, and we know breastfeeding is protective of all those things, helps lower those chances. But of course, the best scenario is that you stop smoking or limit smoking. But most people who, are smoking, if they're breastfeeding, they were probably doing that in the pregnancy. So the baby was exposed to it anyways. So, try to quit or limit, but it's not a reason you can't breastfeed. Marijuana, on the other hand, is not considered safe for your baby, whether it's during pregnancy or during lactation. It is stored in the fat, and we don't have a whole lot of data on the risks of marijuana, but the things that we do know is that it can affect the baby's neurodevelopment and thinking and behaviorally. So, and during pregnancy, it can affect the baby's growth. So if marijuana is something that you're not able to stay away from, then we feel that, maybe a safer option would be, donor milk or formula. Illegal drugs, abuse of even prescription medication, the safer option is to do formula or donor milk. However, if it is a mother that is, say, had opiate use disorder and she is on methadone or she is on Suboxone and in a program and that's being monitored, then yes, we want her to breastfeed. And there is certainly that is a very safe scenario, and we see that a lot. And that breastfeeding is just a wonderful motivational and bonding thing for that mom and baby. And those babies actually do better when they're getting mother's milk. Caffeine, you can still drink your coffee, but probably not more than 2 cups a day. I think shouldn't go more than like 160 milligrams of caffeine. I would avoid energy drinks. There's not a lot of studies, but there's some anecdotal case studies that have been out there about moms who took energy drinks and those babies being jittery. For questions about substances and medications, we would advise you to consult LactMed. That's one of the places we would look up, and there's the web address for that. Another place is Mommy Meds. There's a smartphone app. I think there's a free version and a paid subscription version, but talks about medications in pregnancy and in lactation. So you guys can check that out. Of course, you can always call the lactation office. Okay, reasons for pumping in our last 10 minutes here. We do have pumps, hospital, multi-user, high-quality pumps in the hospital, but a person may pump if their baby isn't able to feed effectively at the breast. Say the baby is in the NICU, the baby was born preterm, or the baby is sick. If the mom is separated because she's at work or school, or really anytime she's away for longer than would what be a normal feeding interval, which would be 3 to 4 hours. She needs to pump and maintain the milk supply, and also pump before separation to provide that milk for baby. We also use pumping to increase supply. Pumping is demand. So if mom is needing to use formula low on supply and her goal is to have more breast milk, then pumping is certainly one of the first things that we would suggest. If baby is unable to latch or transfer milk effectively for one reason or another, we're going to start that mom pumping. If the baby is, in that case, most likely we will need to do some supplementing or giving of the baby mother's pumped milk or formula. We call that supplementing. And if we're doing that, then of course we're starting that mom on pumping to build her milk production. If we store some milk back before return to work, that would be a reason for pumping. When we start introducing a bottle, maybe at 4 weeks along, we're going to obviously need to pump to collect milk for that. If a bottle is given, anytime the baby misses a feed at the breast, we have to remove milk and keep that balance. Whatever we take out of the freezer or refrigerator, mom should be doing a pumping session and replacing that. Some moms pump for because they're donating to a milk bank. Some moms just prefer to do all pumping and bottle feeding, and that is absolutely a fine choice, but it needs to be an informed decision because you need to have a high quality pump if you're going to do that. It is harder to maintain a milk supply long term if we're doing all pumping and bottle feeding. We call that exclusive pumping. Baby is the best pump by and large if we have a full-term healthy baby that can nurse effectively. So it is a little bit harder to, as I said, maintain a milk supply for the long term with pumping. Most insurances will cover a basic electric pump. We can help you out with that in the hospital, but know that if you wait to go to the hospital to get your pump, we do have a supplier in-house. The options for your pump might be limited. We have a supplier called Cornerstone, also known as AeroCare. They're in the process of changing their name. They work with the vast majority of insurances other than AltCare and Buckeye Medicaid. But you're limited to the Spectra S2 or an Amita Maya Joy, and you might want to have another pump. So you might want to get your pump beforehand. A bit of advice, I would say to not use your insurance benefits for a wearable pump. Because a wearable pump it's a nice convenience, but that is not going to be your primary pump. That's your secondary for when you don't have time to use your primary pump. The wearable doesn't empty the milk as well, and you don't know at this point if you are going to have a baby that is maybe born very early or a little bit early, where we are pumping early on to build the milk production. And the wearable pump, if that's the one you used your insurance benefits for, that is not the ideal pump for that. So if you want to get a wearable, I would say get not a super expensive one after you have maybe used your insurance benefits for a primary pump. Some good choices for a primary pump are a Spectra S1 or S2, a Motif Luna, a Similry. Those are all great electric pumps. And if you want more information, call the lactation department. We can help you with that. Remember that milk supply is established within the first couple of weeks. This is our opportunity. The first hours and days are the most important. So if the baby's not doing an effective job of stimulating the breast and removing milk, then that's when we use pumping. Okay, returning to work. I'm just going to read through these points because I don't want to get through the last couple slides. We do have that whole class on returning to work and pumping because this is what always happens. But, you know, most women are going to be returning back to work. So if you can take off your maximum amount of time, you'll never get these days back. That's my suggestion. If you can work part-time or start off working part-time, certainly that's ideal. There are federal and state laws to protect you while pumping at work. They have to do that. So you can look into those laws. You need to start pumping, introducing a bottle and storing back some milk maybe 3 to 4 weeks before you go back to work. You don't need a freezer full to start back to work because every day when you're at work, you're going to be pumping and replacing what baby was getting. But going back to work is a time that sometimes your milk supply can dip. So we need a little bit of a buffer to get started with, just in case we experience that dip. Again, offering a bottle once the breast, if possible, if everything's going well, once breastfeeding is well established, 3, 4, 6 weeks is the ideal. And think about, the daycare or the caregiver. I mean, for many reasons, you want to put some thought into that. But somebody that's going to work with your schedule and not give the baby, you know, too much milk in a bottle right before you're due to come home, and make sure they don't overfeed the baby, and see if you can, feed the baby when you pick them up or on drop off. Make sure they're going to be respectful of your breastfeeding goals. Okay, next is milk storage. Oh, pumping. Yeah. Relaxation is really important. We'll have moms that'll actually use socks to cover the bottle so they're not focusing on how much milk is in the bottles. Pumping is another skill. It takes practice. You got to get conditioned to that pump. So the stress, or even if you're having discomfort or pain while pumping, that's going to really be counterproductive to you collecting milk. So thinking of your baby is watching a video is really helpful to help your milk let down. Using your hands when you're pumping. Flange fitting, you're going to notice if you get your pump ahead of time, it's probably going to come with a different couple of sizes of flanges. We're happy at the hospital while you're there. The lactation consultants can help measure you. We have little template tools for that to measure your nipple diameter, because flange fit is important for comfort and for effectively collecting milk. When you're pumping, you start at a very low suction level, and then you increase that suction, but it should always be comfortable. We generally, in the first days, if you're doing pumping, we tell you to start pumping for 15 to 20 minutes. If have a milk supply built, we're trying to, let's say we're at work and we're wanting to, collect a little bit more milk, then we tell you to pump a couple of minutes even after the milk flow stops, because that extra stretch of the nipples and stimulation is more messages to your body. If you start pumping in the hospital because the baby needs supplemental feeds, or the baby is in the NICU, or the baby's not feeding effectively within the first day, which we see a fair amount, know that it is very normal in those first days for the pump not to be very effective at removing milk. You might not see results in the bottle. So the pump is great for stretching the nipples and providing the messages to your brain and the hormonal release. But in the first days, we often don't get volume in the bottle. But you keep the faith and keep on pumping, because that pumping is telling your body, releasing the hormones to make milk. Just want to caution you about that. And the great likelihood with continued pumping that the volume of milk will come in and you will start to collect from the bottle. Pump Company has great video, and a haka, which is looks like a little vase. It's a flexible silicone, usually. It's a suction milk catcher. It's a great tool. They're usually pretty cheap, but they're not the equivalent of an electric pump. So get one of those in addition if you want, but it shouldn't be like, oh yeah, I have a pump, I have a haka. It's not going to empty your breast like electric pump does. Okay, milk storage guidelines. Here is the chart. We have, you'll be getting a book when you come and deliver, and we have a chart in there also for the milk storage guidelines. At room temperature, up to 4 hours is ideal. In a refrigerator, 4 days is ideal, but in clean circumstances, some guidelines will tell you even up to 8 days. You never want to store in the door. And in a freezer, you can store it up to 6 months, or in a deep freezer. This doesn't talk about that. It's even acceptable up to 12 months in a deep freezer. So if you're at work and you don't have a refrigerator to store your milk in, you can put it in a insulated cooler with a frozen gel pack for up to 24 hours. And that'll be fine for you. Oh, here we are, guys. Where to find help. So there's the number for the lactation department. Know that our phone's available 24/7, but we're there usually from 6 or 7 in the morning till 8 in the evening. It depends on our staffing, but we're there during the day hours. If you call us after hours, you'll leave a message and we will call you back within 24 hours. Akron Children's has a breastfeeding medicine clinics, many of them all over the Akron, Canton area. And they're popping up more and more. So this is a place that you could, even if you have special concerns about breastfeeding or your abilities, or you can make an appointment during your pregnancy to be seen by Akron Children's Breastfeeding Medicine. You can call them or go to their website. They actually have a breastfeeding medicine doctor there. So that is a real wonderful resource that is new to our area just in the past couple of years. Ohio Department of Health has a breastfeeding hotline. There's the number for it. That's a 24/7 service. Of course, the baby's doctor, UroB provider, lactation consultant. There's WIC clinics. Those are government, usually at health departments. WIC is Women, Infants, and Children. They have lactation consultants and counselors on staff. La Leche League is a very old organization that is still alive and thriving, and they provide wonderful breastfeeding support and have a very wonderful website. And then if you're interested in more videos, I would guide you to firstdroplets.com. Or globalhealthmedia.org. They have wonderful videos on breastfeeding and pumping and hand expression and all the things. So, and yeah, you have all the resource numbers to contact somebody. So thank you for spending this time with me, and I hope you meet all your breastfeeding goals. And if you see me in the hospital, say, hey, yeah, I took that online breastfeeding class. I think I saw you. Yeah, make sure you let me know.